Ladies and gentlemen, welcome to our presentation. My name is Nancy.
And my name is Mary.
Today we will talk about generalized anxiety disorder. Here is our table content. 1. Concept of generalized anxiety disorder. Generalized anxiety disorder test.
2. The reason of generalized anxiety disorder.
3. Symptoms of generalized anxiety disorder.
4. The difference of GAD and normal anxiety.
And last is the solutions of generalized anxiety disorder, medicine, benzodiazepines. First, the concept of generalized anxiety disorder. Generalized anxiety disorder occurs in people who have excessive anxiety and stress about an activity or surrounding events, and this condition lasts for at least 6 months. According to statistics, this disease affects about 3% of all adults and 6% of children aged from 13 to 18 years. This condition causes prolonged anxiety and fear about an activity taking place around life, such as family, work, study, health, and relationships. People with GAD often have a pessimistic and negative outlook on life, and if not treated, the patient easily has thought and behavior of self-harm.
Generalized anxiety disorder test. The GAD-7 scale is a scale to assess the generalized anxiety disorder. The GAD-7 scale helps assess the anxiety disorder. This scale is often assess the psychological status of people experiencing difficulty in life. GAD-7 total score for a 7-item range from 0 to 21, in which 0 to 5 no anxiety symptom, 6 to 10 mild anxiety but need to find the cause before it gets worse, 11 to 15 moderate anxiety, see professional to help, 16 to 21 severe anxiety, urgent treatment needed.
2. Reasons of generalized anxiety disorder. The exact cause of generalized anxiety disorder is not fully understood, although it's like a combination of these. Genetic. Updates about the childhood ever suffered. Live in a stressful environment. Addicted to stimulants.
The symptom of generalized anxiety disorder. People with the disease often have the following signs. Excessive worry. The person with the disease always worry about small things. Think too much about plan and all the situation for all cases can happen. Stress and trouble. Another symptom GAD caused by human. People can relax and it is difficult to concentrate. The third symptom, indecisiveness, afraid to make wrong decision. And the last symptom, personality is easy to change, irritable and erratic.
Fourth, the differences of GAD and normal anxiety. First, worry about everything. Most people are all worried about things related, provoking anxiety situations or same thing. However, people with GAD tend to be described worry about everything, even if it's no harm to them. Next, can control the anxiety. Normal people can control the anxiety through coping or self-smoothing skills. People with GAD having difficulty with this issue. They find it difficult to find relaxation, calm, and time away from their anxiety. And finally, worry is more frequent and more intense. People with GAD worry about a problem for a long time, even when the situation has been resolved, and the anxiety is more frequent and intense than other people in the same circumstances.
solution of generalized anxiety disorder. Using medicine, psychotherapy, exercise with appropriate exercise and sport, build a nutrition diet. Medicine, benzodiazepine. Benzodiazepines are a group of compounds that are used hypnotic, anxiolytic, muscle relaxant, and anticonvulsant. The core chemical of this group structure formed by a combination of benzene ring and diazepam ring.
To know the benzodiazepine mechanism of action, we need to know about the physiology and function of the gamma aminobutyric acid, GABA, the neurotransmitter. GABAs are neurotransmitter in the center of the nervous system. It can increase or decrease the stimulation ability of the neurons and so adjust the brain. So now, let's discover how benzodiazepine work. In the synaptic, where GABA acts like a neurotransmitter, action potential release the GABA. Then open the GABA receptor, allows chloride ions to go inside the postsynaptic cells. The GABA is inactivated by taking back into the axon terminal through a process of reuptake. Benzodiazepine also connect with GABA to help the chloride ion influx. And when the GABA and the benzodiazepine compounds with the receptors, it will let more chloride ion go inside the postsynaptic cells.
Besides the GERD effect, if you use overdose or wrong medication, you will have this signal: respiratory depression, respiratory arrest, vomiting. So we need to discuss with the doctor to find a good medication or use the correct dosage. Thank you for listening.